So notice in the lower right-hand corner, I've got the U.S. Department of Census and the National Institute on Aging. I've also got their websites listed there, and I might have a specific article cited from which I pulled information about this particular customer. I'm starting to get a picture here that there's a population explosion coming. That's almost doubled from 282 million to 420 million in 2050. Whatever the curve looks like between now and then, you might consider that this population explosion represents increased pressure from a medical perspective on how do you provide care to all those people. Here's another group. I went to Center for Medicare and Medicaid. I went to Goldman Sachs economics paper. I went to the Bureau of Economics Analysis. And I got an idea that in the expenditures on healthcare information is going from 2.1 trillion to 4.2 trillion by 2017. Now this is right around the corner. That's a huge jump from 2006 to 2017, from almost double. It is exactly double the amount of money that we're going to be spending on healthcare. Now, military health system, as we figured out from our market research, is intimately connected with those other agencies and other organizations that are providing healthcare, to include the civilians. So if their healthcare costs go up, it's reasonable to assume that our healthcare costs are going to go up. And so we're facing some economic pressures. Government program and statistics. Here you've got Social Security and Medicaid Board of Trustees cited along the bottom. We have the $53 trillion asteroid by Glenn Beck at CNN, a specific article that was cited there. And on this slide, you can see that the insurance and Social Security, the entitlements that people have to help cover their health care insurance is going to be going down. So at the same time, we've got a population explosion, we've got increased economic pressures, and we've got the ability to pay for all those programs starting to dissolve. Can you get a good idea of what might be going through the mind of our military leadership? I'm going to complicate the story a little bit more by looking at some information from the Federal Interagency Forum on Age-Related Statistics, and the Center for Disease Control, and the American Diabetes Association, and Georgetown University studies. Here I've extracted some information about the population and about the diseases that we're going to be facing. So now we've got increased pressure from income and economic pressure. We've got an increase in population explosion, and now we've also got an increase in disease complexity. As people get older, the diseases processes that they wrestle with tend to get more complex. So now I've got an idea from these kinds of statistics that our customer is probably in dire need of the ability to control and make reasonable and measurable management course corrections to their environment over time. The 2 and 3 stars and the deputy assistant secretaries are going to want to have definitive control, financial visibility. They're going to want to know when they make a change in management course correction, what's the effect that that's had on the entire military health system. So they're desperate for financial visibility. Here's some more statistics about shortage of staff. So if it's not bad enough, we've also got a huge shortage in providers, which means they're going to be out there actively recruiting. They're also going to be short of staff to get the work done. So now we take this information and we have to come back and start our strategizing. Some basic questions we should ask ourselves about every single customer. Why should they buy our products and services? Looking at the picture that we just put together a few minutes ago, are there opportunities in there that our products and services might be of value to them? How will our products and services benefit our customer? We have to describe what our products will do. Now, we have to describe what it will do for them specifically, and we also have to describe what they will do, period. So what they'll do for everyone and what they'll do for this particular customer. They are two different statements, and they're both equally important. Same thing for what will they accomplish, and the accomplishment is normally measured in terms of outcomes. How they will do what they do. If you recall back to our Change Management Council sessions, we talked quite a bit about 4 different personalities that are out there, and there is one personality that is primarily focused on the how. These are techies. How does X work? What's the process for it? We have to describe that. And then for the advocates out there in our population, we have to be able to explain some creative things that our customer can do with our products and services.